Today we will be talking about the face masks and the surgical masks and the face covering, for example, homemade bandanas or scarves or things like that. So let's start our discussion. The most important thing that I want to do today is I'm going to talk about the respirators, I'm going to talk about surgical masks, and then I'm going to talk about the homemade remedies or elements that we can use. The first message that I want to give, so let's have a quick discussion about should we general public wear a mask or not. So there have been many messages here from the WHO. The message has been do not wear, for general healthy people, they are saying do not need to wear a surgical mask because they feel that they do not protect from getting the infection, which is correct. Secondly, they feel that the mask provides an unnecessary feeling of protection, which in turn makes you touch your face more often and bring the virus near the nose and mouth and eyes even more. And thirdly, they feel that the mask itself is going to carry the virus on it. And when you are going to manipulate it or put it down, you are going to keep those areas contaminated as well. Walaikum assalam, Nurmeza. Thank you very much for joining. Rachel, hello. Thank you very much for joining. We're talking about the masks today. So on one end, WHO says do not use the masks. On the other end, I watched a video of a doctor from South Korea, and he was very adamant that one of the major success in South Korea, one of the reason for the success in South Korea was that they were all wearing masks. So his criticism of Europe and America was that you guys should make sure that you are wearing masks. Do not drop the ball on this thing and figure out if it is necessary or not. So I'm going to put my opinion out first. My opinion is we should all wear surgical masks when we are out in the community. So healthcare professionals should wear N95. Other people should wear, healthy or not, should wear surgical masks. So I'm going to have that discussion today with some scientific studies to put in front of us to provide some thinking for should you do it or not. So let's start. I'm going to once again have the same thing that I'll have a whiteboard here. Walaikum assalam, everyone who is here. And let's have that discussion. So first of all, I'm going to start with, we'll discuss this thing in the terms of spread, that what is the spread of this virus, how does it spread? I'm going to focus only on the airborne spread instead of fecal oral or fomite at this time. Of course, for fecal oral and fomite, we should wash our hands. I'm talking more about the respiration, inhalation, and exhalation. So that is one. The second thing I want to do after the spread, I want to talk about the size of the virus, the size of the droplet, the size of the holes in the respirators or masks, and then what can these things do. Then we will talk about the masks themselves and see the difference between them. And then the recommendations. Again, I keep spilling the beans. So this is Dr. Bean here. I keep spilling the beans that I believe we should all start wearing the masks now. So let's see. First of all, a study. I'm going to share my screen. Absolutely. Tiffany says don't forget to wear glasses. Absolutely correct. So I see this that you're right, but nowadays surgical masks are not available. Then do something from home, have a scarf or something. But whenever you go out, wear something. And it is important to know that if you are isolated, if you're alone, don't need to wear it. If you are with your family members with whom you have been already, then you don't need to wear it. But if you go out, then it is necessary that you start wearing them. Do something. It is going to be better than nothing. So let's have that discussion. First of all, I want to show you a study. So I'm going to share my screen. And there is a study done. It is from China. And if you can see the screen here, this is in JAMA network. So it's, of course, quite a reputable and respected publication. Here they have talked about a woman. So I just wanted to give you an idea that there is a study here. And what they are talking about is that there is a woman in Wuhan who traveled out of Wuhan. She did not have any symptoms. She went and met another 5, 6 family and friends. In that process, when she met them, they became ill with COVID-19. They developed symptoms and they had the disease, while she did not have the symptoms even till the 19th day. Remember, the symptoms can appear between 0 to 14 days. Median is 5.1 days. However, she fell to the 19th day for the symptoms. But while she was asymptomatic, she was shedding and the people around her were becoming ill. This is a very, very important thing to keep in mind, because my recommendation actually is based on these kind of events where asymptomatic people may be shedding, or people who are symptomatic but they do not know that it is COVID-19. They might think that this is just seasonal flu or allergies, and now they're just roaming around and doing their work and carrying on with their life. In the process, they are shedding. So let's talk about the next step. So the first is, we understand that asymptomatic patients can be shedding. Even symptomatic patients who do not think that this is COVID-19 can be shedding. Now let's look at the sizes of the droplets and those. So look, when from our mouth or nose, the droplets are coughed out or sneezed out, or if we are laughing, or if we are yelling at someone. So I think that for COVID-19's sake, we should not yell at people, because we might actually transmit COVID-19. So yelling is stopped during the COVID-19. So when these droplets come out, the important thing is that these are of two types. One is what we call aerosol, and aerosol are the droplets, or the size of the droplet, water droplet, lesser than or equal to 5 micrometers. That is also called a nucleus. So it is a aerosol particle. It can remain in the air for a longer time. Then the thing that is called droplet can be anything greater than 5, not equal, but greater than 5 micrometers. And this can go up to 100 and 1,000 of micrometers. For our purpose, we'll just use this definition of a droplet being greater than 5 micrometer and aerosol being smaller than 5 micrometer. Aerosol can stay in the air for 2 to 3 hours or more. Droplets usually fall down within 6 feet of the transmission immediately. So they very rapidly, if I coughed now, within a few seconds, it would just fall within 6 feet. Hi, Deborah, how are you? So this is one thing. Keep these numbers in mind. Keep this size in mind. Now the virus itself. So let me make it in blue. If this is a water droplet, so just like this is the water droplet and this is a droplet. So if it is a droplet, the virus that is sitting on it is anywhere from 90 nanometer, it's not micrometer, to 110 nanometer, which is really small compared to the micrometers. Good. So we now know two things. Walaikum assalam, Wajahad. No, we'll be okay. But think about it. AP, I think we have a solution here. So we will be safe. Follow me. We should all start wearing the surgical masks and we'll be okay. So now the virus is smaller in size. The water droplet is bigger in size. It is greater than 5. I keep putting the equal micrometers. Now, the whole size in masks, let's say respirator, and I'll explain what these masks are and what these respirators are, is about 300 nanometers. It's about 300 nanometers. Now keep in mind that the virus size is 90 to 110 nanometer, but the droplet size is larger. It is about 5 micrometer, which is like 5,000 nanometer. So if I make a droplet here, which is 5,000 nanometer, and that comes across a small hole in this respirator, which is really just 300 nanometer, then the droplet would get stuck over there. So this is the basic concept here. So keep this in mind. Thank you very much, Aaron. So there is Monterio says, isn't transmission from asymptomatic actually rare? I saw something about a study, I think from Thailand. Absolutely. So we keep saying that the transmission from asymptomatic is rare. And I just addressed that before I started, when I started this. Look, there are three kind of people who may be asymptomatic. One, youngsters. I talked about a study here, which I showed on the screen. When you get a chance, please look at it again in the beginning. I showed this study. It is published in JAMA, where a woman, 19 or 20 years old, she was asymptomatic. She remained asymptomatic for 90 days, but she shedded, and she made 5 family and friends members sick. So she was shedding. So number one, youngsters can have the disease, may not have severe symptoms or bothersome symptoms and still be shedding, number one. Number two, children can be shedding. And number three, people who are, of course, who are sick can be shedding, and they may not know it is COVID-19. They might think it is seasonal cold, or this just flu or allergies, and they are shedding. And of course, number four, people who are in the recovery state, their symptoms might start going away, but the remnant virus may still be there, which is still being shedded. So please realize that even if we are asymptomatic, that does not mean we do not have it. I would suggest we all assume we have it and then behave according to that. So with this, now let's go back to the discussion that I was doing. So here, the sizes should be clear. The virus size, 90 nanometer. The droplet size, 5,000 nanometer. The hole in the respirator, 300 nanometer. So I hope this is clear that if the droplet falls on the respirator, it is going to get stuck over there, and the virus is smaller. It has a chance to go in, but the filters in the respirators are such that they would prevent it. So 95% of the pathogens, airborne pathogens, will be prevented. So far what we have talked about is that there is spread possible when we do not know that the person is sick, or even if the person is sick, they are still spreading and do not know that they are spreading SARS-CoV-2. One. Second, the droplets are of two types, aerosol and the droplet. Now let's look at the third thing which is important, and that is the masks themselves. So let's talk about the masks. And I'm going to show you masks here on the screen. So first of all, this is surgical mask. A surgical mask, this is the diagram. It has this metallic thing in it, and then it has these pleated fabric here, and then these things. A surgical mask, so please realize, masks has two types of utilities. Masks have two types of utilities. One is that a person, so let's say this is a person who is wearing the mask. So he or she is wearing a mask. It is to protect the person from other person who may be sick and shedding. So this is person A, this is person B. This mask the person A is wearing mask is supposed to protect that person from the other person who is transmitting the virus. This is one kind of mask that is needed. The other kind of mask is that the person who is shedding, who is sick, we provide them with the mask so they do not shed outwards. Right? So understand that the masks are going to be understand that the masks are going to be of two kind, or their purpose is going to be two. Number one, if I am sick, can I wear a mask that would prevent others from getting my disease? Or if I am a doctor and I am exposed to a high number of people who are sick and I'm exposed to a higher dose of the disease, can I protect myself? So now with this, can a person get reinfected? No, reinfection is not possible, but we do not know how long the immunity is. Okay, so back here to the masks. I actually went back to my camera. To the masks. So look, the surgical mask, which I am asking all of us to start wearing. Surgical mask allows a person who is sick to catch their secretions, their droplets in the mask. There is a study here which says that the surgical masks can actually, here is the study. The study says that the surgical masks, and this Wikipedia article here as well, it shows that the surgical mask benefit is that the droplets that are going out, they are stopped. Surgical mask cannot stop the aerosol, but the droplets are stopped. Isn't that good enough? If I am sick, I am symptomless, and I am moving around in the society, if I'm wearing the surgical mask, at least I will not be making other people sick. Right? So surgical mask would prevent others. It is like isolation and staying at home. When we are asking people to stay at home, why are we asking them to be at home? We are asking them to stay at home so that, number one, if they are sick, they are not in the community and they are not making others sick. And they'll become ill at home, and then we can manage them. We can take them to emergency if needed. And second is that you stay at home because you do not know in the community who else is sick, who is going to make you sick. So isn't this mask a similar behavior here? That if I am sick and I am in the community, I am wearing a surgical mask, so majority of my secretions, nasal secretion and the droplets on the cuff are trapped inside the mask, and I'm not shedding it to everyone. Wouldn't you want everyone to do this? We do not know how many people are sick. We cannot test them all, but we can ask them to wear surgical masks at least. So, important thing is that surgical masks are supposed to be preventing. This is why the surgical masks were used in the surgery as well. What was the benefit of that? In the surgeries or during the surgeries, what we wanted was that the patient would not get the infections from the surgeon. So we will ask the surgeon to wear the surgical mask, so the surgeon's own secretion, nasal secretion, or droplets from their air, from their breath, will not contaminate the surgery that is happening or the wounds. So I'll talk about cloth masks in 1 second. Very good question, Deborah. Just hang around for a few more minutes and we'll talk about that. I'm going to talk about surgical mask and respirator and then cloth. And I have studies here to show. I think these will be very interesting to look at. So is this clear about the surgical mask? Surgical mask prevents exhalation or transmission of the, let's say, COVID-19 or SARS-CoV-2 from a sick person. Now, important thing, droplets are trapped. Aerosol is not trapped. So if the patient is shedding very tiny, lesser than 5 micrometer particles, they are usually not trapped. But luckily for COVID-19, aerosol amount is very, very low, but droplet amount is very high. So if I am sick, I should have a surgical mask. I do not know I'm sick, so I should have it all the time. You should all have the surgical mask all the time. Is this clear? I'm going to talk about it, that everybody is talking about the same thing, and Deborah asked this question too. So I'm going to talk about that in a second. But I want to make sure that the surgical mask concept is clear, that it is for exhalation of the droplet, and we should wear them to prevent others from getting our disease. Good. Now I'm going to go to the respirators. So respirators are highly sophisticated masks. And let me show you a respirator. This is a respirator here. These are, and look at these markings here. Respirators are, in the US at least, approved by NIOSH or NIOSH. They provide this rating, and they have a site. So many of the people, I cannot imagine, guys, that people can take advantage of these kind of times and do wrong things. They have a site where they have, let me show you, required. So here is the link to a site on the CDC where counterfeit masks can be reported, and they put those reports up as well. So these are the brands who just decided to say that we are NIOSH approved. I cannot imagine people can do these kind of things. So anyways, then CDC would come out and they will put those unapproved masks that they know about on their site. So keep this in mind, that CDC has a page where they put that. So back to the surgical masks. Respirators. Respirators have European standards, US standards, and China. I'm sure that there are more standards from other countries too. I'm going to talk about these. Europe classifies respirators as FFP1, FFP2, and FFP3. Filtering faceplate masks. So FFP1, these masks are supposed to block 80% of the pathogens, airborne pathogens, and they have 20% leakage. Leakage means that when they are fitted on the face, if this is the mouth, from the side, there may be still the leakage of the pollutants or bad air. Now remember one thing, respirators are to protect the wearer, the person who is wearing them, especially healthcare workers who are repeatedly exposed to the disease. They are supposed to wear the respirator, so they are protected. Respirators are tested for their efficiency from outside inward. Keep this in mind. Respirators are tested for inhalation efficiency. Surgical masks are tested for exhalation efficiency, that do the block things on exhalation. Respirators are tested for blocking in the inhalation. Now, Europe says FFP1, which is 80% blockade of the pathogens, airborne, 20% leakage allowed. FFP2 is 94% blockade of the airborne particles and droplets, and about 8% leakage allowed. And FFP3 are greater than 99% blockade and 2% or lesser leakage allowed. This is the European standard. In the US, FFP2 are what are called N95. So US have its own regulations. So in our regulations in the US, we use the term N95. N means it does not block the oil from passing through it, and 95 means it blocks 95% of the pathogens, including viruses, to pass through that and into the mouth or nose of the wearer or the person who is wearing it. And China has, I believe, KN95, if I am correct, and these are not approved in the US. So respirators are to protect the wearer. Surgical masks can protect the wearer from bigger splashes of body fluids and blood and other, but mainly protects the persons in front of the wearer. Walaikum assalam. Is this clear? Now, let's think about it a little more. Can everyone get a respirator? No. So respirators should be kept for healthcare professionals. Let them wear it. Leave these for them. But all of us, the remaining people, we should wear surgical masks. It is going to make a huge difference. Now let's talk about the home remedies, the cloth that can be used. So scarves or cloth and those things. So scarves or cloth or other things. And for that, I have a study here for us to look at. Here is the study. Where is that study? Sorry about that. Give me 1 second. Here is a study. This study here is showing the efficacy of homemade mask compared to a surgical mask. And this is looking at expelling the virus or the droplets. So this study is talking about a homemade mask that we are wearing and the efficiency of or the effect on expelling the droplets. So they have seen that homemade mask protects for expulsion 3 times lesser than surgical mask. So it is 3 times less efficient than a surgical mask in transmitting the particles or droplets. Good. Homemade masks are 3 times less efficient in transmitting. Then I have one more study here. This study here is showing, so this is a study of homemade mask in receiving the infection from someone else. So if you are wearing something which you made at home and now you're roaming around and somebody is sick and they are going to give you the disease, what is the efficiency of the homemade masks for that? And so for that, if you see here, the results short-term inward protection. Inward protection means inhalation from someone else. And they say that they are 25 times worse than surgical mask. So if I make something at home and I wear it, what is the number now? If I'm wearing it, it is 3 times less efficient for expulsion. If I'm sick, I'll give it to others. And it is 25 times less efficient in blocking. And compared to N95 respirator, it is 50 times less efficient in blocking. But both studies say this, that in the absence of anything else, homemade masks significantly reduce the transmission and reception of the droplets. Yeah, absolutely. They say the same thing. It is better than nothing. So Aliana Johns, thank you very much for this comment. Better than nothing. So homemade mask should be used, homemade mask or whatever that, the cloth or something, should be used if you do not have anything else. But the point I want to make is we should all be wearing masks. This is a mistake on our end. This is a mistake on WHO's part. This is a mistake on CDC's part. This is a mistake on our government's part to say, don't wear masks. We need to wear masks. Number one, to prevent the transmission from us. And number two, to make sure that we have lesser chances of getting it either. So look, if 2 people are standing next to each other, they both are wearing a mask, surgical mask. One of them is sick and one of them is not sick. They both are asymptomatic. Or the one who is sick feels that he just has allergies or he has some common cold. The person who is sick, when he's wearing a surgical mask, all his droplets are blocked. That is a huge difference. So we keep saying, wash your hands. That is good for fomites. That is good for fecal-oral route. But what about the breathing from which it is transmitting mainly? So that is what I have for the discussion today. I want to show you a few more things and then we'll close. Here is a OSHA, Occupational Safety and Health Administration in the US. This is their PDF about the use of these masks and who should use respirators for healthcare professionals and surgical masks for others. Here is a discussion that respiratory virus shedding in exhaled breath and efficacy of face mask. And I have already discussed the efficacy, but um, there is a study here in the Nature, and it is a very powerful study that we should wear masks. We are making a mistake by not wearing them. This is another study where the leak of submicron aerosol through surgical mask and face mask for pediatric. It's for pediatric, but I wanted to put that here. This is the recommendation from the CDC government, and I want to talk about these two definitions here. CDC is coming out and saying that when we do not have the masks available, then you can, this is for respirators. They are saying that if respirators are not available, you can extend them or you can reuse them. And let me talk about the definitions of these very quickly. Extending a mask means that you're wearing it. So you're wearing it and you continue to wear that while you visit more than one patient. And normal life of a mask is about 8 hours, but they have various recommendations that when do you say not to wear it. For example, if you inadvertently contaminated it, if blood fell on it or other fluids fell on it, or if the mask has started deteriorating, or if the fit is gone, in that case, take it off. Otherwise, extending the mask means you continue to wear the mask while you visit from one patient to the next to the next. Reuse of the mask means that you take the mask off. So you are wearing a mask, you take it off, and then you wear it again for the next patient. So this may be when your shift is over, you put the mask in, then you come back and you use it again. That is what they're calling reuse. In the case of reuse, they are giving a couple of extra points when not to reuse. And one of them is that if you have accidentally touched the inside of the mask, then do not reuse it. Or if you have not been wearing gloves and accidentally removed it with hands, then don't reuse it. And thirdly, they say that for reuse, to take the mask off and on, use clean gloves. So our government or authorities, agencies, not government, agencies have come out and said, in case of less respirators available, please extend them, not extend, or reuse them. I hope it is clear what extension means and what reuse means. So that is the definition here, extend or reuse. And they have certain contraindications when not to reuse. So you can look at this page here. So I wanted to share some of these things as well, where they say that face masks will not help. What they are forgetting is that the masks are going to really help when the people, if everyone is wearing it, then sick people are going to be wearing that too, and they would reduce their transmission to us. Or I don't know if I'm sick. So anybody who is sick would reduce the transmission to others. This is if you have a N95 mask and you are not sure if it is a fake or a correct mask, then there is the CDC has the criteria for how you can see if it is correct. These are the markings that should be on the mask, and I showed you a site before where you can go and confirm if this mask is approved. And again, this is a page again where those masks that claim to be approved but are not are listed here. Whichever they find out, they would be listing them here. And that's it. So tell me, do we agree that we should all wear masks, at least surgical mask? If not, then homemade remedy? Very good. I love it. Kevin, this is a great news. And thank you. I am seeing, just like I am seeing so many idiots who are making false masks and creating rumors, at the same time, I'm seeing the beautiful heart of humans who are taking care of others. They are donating supplies, they're donating food, they're providing care. So as much as there are criminals out there there are people who have golden hearts. And so thank you very much for doing these things. Say something about, so there's a question, say something about method of wearing a surgical mask. Look, surgical mask wearing is a very simple. You take the mask and first of all, you bend it to your nose. Then you elongate or you pull it, the pleats, to kind of cover up to your chin and then wear it here. So that is the wearing. It is the removing which is more serious because now it is contaminated. So wear gloves, take it off very carefully without shaking it. So you do not shake the virus and the pathogens everywhere. Put it in the garbage bin right away, throw the gloves, wash your hand. Every time you touch your mask, they say that before touching and after touching, you should wash your hands. So what do you think? Any other question? So many people say they put on and put off time and again same mask for many days and they might be transmitting it. Yeah, so that, Amira, that may not be the best thing to do. There are very strict ways to reuse them. So taking a mask, wearing a mask is called donning a mask, and taking it off is called doffing a mask. So donning and doffing should be done very, very carefully with the proper hygienic protocols. So what is this? Yeah, I was going to ask the same question because there is stigma now wearing in two sides. No, don't wear on two sides. That is now not how these masks are made for. The surgical mask is made for stopping the outward flow. If you turn it off, that is going to be useless. Similarly, of course, respirators cannot be done that way. So, Aaron, I have actually looked at the CDC's homemade masks, and I just discussed that before. Maybe you were not present at that time yet, that the homemade masks in transmission, they are 3 times less efficient compared to a surgical mask, and in receiving, they are 25 times less efficient compared to a surgical mask. So there is a question here. You discussed the size of the droplet being larger than the holes within the mask, but in current practice for patients, where did it go? For patients that are positive SARS-CoV-2, we are using surgical masks and face shields for medical staff. What are your thoughts on that protection? So that is useless. Surgical mask for medical staff to be protected from patient is useless. Surgical masks are outward protecting, not inward protecting. Respirators are inward protecting. So if you are wearing a surgical mask, you should give the surgical mask to patient to wear. Their droplet will be blocked. But if you are wearing the surgical mask, it's not going to do much. So again, I want to make sure that we all know, why am I asking we all wear? So that whoever is a patient, their droplets will not be transmitted. A healthy person wearing doesn't really make much difference, but who knows if I'm healthy or not? Who knows I'm shedding or not? So we should all wear it. That's the message. So there is a question from Lameen. Hi, Dr. Bean, is your program okay for nurses or is it too advanced? No, it is actually, I have been so passionate. This is a good question, probably not this topic. I've been so passionate to make sure that nurses and PAs have a better understanding of medical concepts so they can actually elevate their practice and they can be safe and successful. So I have specially made sure that our content is aligned with the way nurses and NPs and PAs. The only thing is we don't have nursing procedures at this time. We have primarily explanation of pathophysiology or the discussions like these, which kind of elevate your understanding of the medical concepts and help you become better in your practice. So Ahmed Saeed is asking about the reuse of N95. I just explained that according to the agencies, there can be extension and reuse, and I explained what that means. So Kawal says, if we wear double surgical mask, can they benefit us from infection? I don't think so. I think, of course, doubling is important. There have been 3 masks worn, so 2 are better than 1, but give the patient a mask. Everyone who is a patient should be wearing a mask, and we should all assume we are patient, we should all wear a mask. What is the current situation of international medical students who match that are coming from? This is not the It's a good question, but I am discussing a different topic at this time. Sterilization of mask. So, Laura, there are many protocols for sterilization. That is why I'm specifically avoiding this topic, because this is still an evolving literature now and experiments to say we didn't think that we'll have to sterilize and reuse the masks. So I don't want to talk about what is the right way, because I'm not sure which is the right way yet. So, Kevin, as I just said, CDC says that you can extend or reuse the mask. You can extend means keep wearing the N95 respirator and meet more than one patients. And reuse it, you take it off and then you wear it again. So we'll talk about vitamin D at a later time. So guys, thank you very much for your time. I want to finish this live session, and we will start again tomorrow. I want to keep doing this vitamin C and D, and I just have all of those topics that keep coming up. I thought that mask was important for all of us, especially in the West and in the US, to know that we should wear masks. We should all wear masks. Thank you, guys. Stay safe and healthy. And respect to all of you on the front lines. You are doing an enormous job. You are risking your lives as well. So thank you very much.